I Perfect. I found it. So Raji, very time consuming to apply for jobs. Tailor, CV, cover letter, selection criteria. Yes, unfortunately, it is time consuming, but unfortunately, it's also something that needs to be done. And it is actually required to be done if you want to increase your chances. The main point there, it is something that I'm going to be talking about. It is actually applying for the right jobs. Okay, because when you are actually applying for the correct jobs that you are actually eligible for, there isn't that many, and I'll be talking about that. So it becomes very time consuming when IMGs are applying for many jobs, which they are actually not eligible for. And that creates expectations and so on, but I'm gonna dive into that more in our presentation, okay? So I will give a start soon, but I just wanna give you a little overview of how we're gonna be running this today, okay? So I will be here talking for about 25 minutes. I'll be covering positioning, pathways, what hospitals look for in your applications, how you can improve your applications, okay? And then when I'm done, I'm gonna be handing over to Aaron. Aaron is gonna be talking to you for about 45 minutes today. He's gonna bring the view of an examiner when it comes to AMC2, which I find really important for you guys to actually understand. So make sure you have your glass of water, make sure that you have your coffee, make sure that you stay tuned, okay? Because I do believe that the information that's going to be shared today can actually change your life. If you have any questions, pop them into the chat. We are going to be dealing with the questions at the end of the webinar. We are going to be allocating 15 minutes towards the end so that we can answer as many questions as we can, myself and Aaron. And we have Arnold here as our moderator. So he's going to be assisting you guys in anything that you need. Okay, so without any further ado, I think I will dive in because you are here on time. So let's start. Okay, so basically, I'll just quickly talk about my experience and background so you know where the information is coming from and who is actually here speaking to you guys. So my role within IMG Career Branding is actually to help international medical graduates to navigate the Australian medical system. So I provide advice on eligibility, registration pathways, and realistic entry points. I think that's a very important thing to discuss today. As I said before, most IMGs that I work with, I've been working with a lot of IMGs. The biggest mistake that I see them doing on a daily basis is actually applying for the wrong roles. And that creates a lot of frustrations. So understanding a realistic entry point for you can save you a lot of frustration, okay? So I help doctors to position themselves, which is a subject that we're gonna be talking about today. Positioning is really important so that when you send your applications, the hospitals, they understand exactly where you stand when it comes to your pathways, your AMCs, your eligibility, right? Which sort of APRA are you actually eligible for, your visa status, and so on. So I explain how hospitals, colleges, and workforces, they actually access IMG profiles. And I help doctors to identify and address the gap between where they are right now and what they need to do in order to become employable by an Australian hospital, okay? So I help doctors to bridge that gap between where they are and what they need to become in order to become employable to an Australian hospital, okay? Usually what I see happening a lot, I feel that IMGs, they decide that they wanna go and work in Australia, they jump into AMC1, they jump in, do their English test, they start applying for jobs, but there is no career planning. in career planning is something very, very, very important in Australia. Okay, I'll just time myself here to make sure that I don't go over time. So planning your current experience. What are you doing right now that's going to affect, you know, the job that you want to get in Australia? Do you have enough CPDs? Do you have enough experience that actually aligns to the entry roles that you are planning to get in? Do you require an observership? You know, I've worked with specialists that are actually entering the system through the standard pathway, and they're actually pivoting their career. And the plan is, okay, let's go back and start working, you know, in the wards, you know, with acute presentation and so on, that you have some recent of practice that's actually relevant to where to help you to get the first job, the first entry job role. So it's all about that. It's all about planning, understand where you are and what you're going to have to add to your experience, either that being, you know, your clinical experience, or, you know, an observership that will give you exposure, or, you know, any CPDs that you may need to do, and so on. So I feel that everybody is like, okay, I've passed my MC1 and I've done my English test and I'm ready, when the reality is far from this. Okay, once you start getting the rejections, that's when you start having the wake-up call that, okay, something is actually not right. Okay, I need to change something in order to make things happen for me. And usually that's going to come from knowledge, come from understanding how the system works so that you can adjust. Okay, so let's move to the agenda. So I'll touch into pathways, and then I'll talk about positioning, how hospitals will be assessing your applications, the most common mistakes, and how you can make your applications stronger. It's not just about the applications, it's about how can you make your experience more robust so that that reflects what the hospitals are actually looking for, okay? All right, then. So understanding pathways. So as most of you probably know, the most common pathways to get into the Australian system, it's actually 3 of them: the competent authority pathway, the standard pathway, and the specialist pathway. The standard pathway is the most common one for IMGs, because most IMGs, they are actually coming from non-speak English countries, right? So this is the most common pathway for everybody that actually wants to come and work in Australia. What happens there is it's a massive pool of candidates. It's really a massive pool of candidates. And when you look at profiles, you start realizing that everyone more or less is at the same level. Everyone more or less is very, 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 very similar. So imagine when hospitals are receiving applications and everyone is pretty much the same, what you need to do is you need to start thinking about, okay, how can I stand out from being in this pool that has got thousands, right? And why it's important to understand your pathway. And the reason why I'm touching on that is because a lot of doctors that I work with, usually they are not even clear on their pathway. Okay, and the pathway is something extremely important because it is part of your eligibility. So when the hospitals, they are receiving your applications, it's really important for them to see straight up which pathway you are in, right? So that they can make the decision quickly about, okay, you know, we are moving with this person or not moving with that person. Okay, so the pathway also determines the APRA registration that you're going to be eligible for, but also your entry roles into the system. Okay, and what is a realistic starting point for you. So have an understanding of the pathways is actually very, very, very important. So most roles that doctors in this pathway should be looking at in terms of entry points is HMOs, RMOs, JMOs, SHOs, okay, which are the junior entry roles into the Australian medical system. And these are the positions that actually will require supervision, okay? Probably most of you know that you'd be working under supervision roughly your first, second year until you really get into the system, okay? And so understanding a pathway is actually really important to the hospitals because this is one of the things that they actually use to interpret your background, okay? It does help them to assess your applications. How are we doing so far? Are we following everything? So give me the thumbs up on the chat. Let me know how this is going for you. I'm just taking a look here. Yes, okay. So who else? Let me know how this is landing for you. Okay, it's making sense, okay? Perfect. That's very good, guys. I'm glad that this is making sense for you. So the next slide, we are going to be talking about how hospitals actually interpret IMG profiles. I just need to have a sip of water first. Okay, so once the doctors, they start applying, hospitals, they don't just look at your qualifications, okay? They are really trying to determine whether you can actually work safely and actually integrate into their service well, of course, being a good fit, but also at what level. Okay, so they are not looking just at your qualifications, they are looking at a number of things to make sure that you'd be a good fit for their jobs, okay? So they are looking at the doctor's background, training, to understand how it aligns with the Australian medical system structure. At the same time, they are looking at things that are really, really important. And there isn't like one or the first, second, third. They are looking at all of them at the same time because they all need to make sense together, okay? So they are looking at clinical reasons, key eligibility. So when we're talking about eligibility, we are talking about your AMC status and progress, your English tests, your APRA eligibility, and also your visa status, okay? They are actually also assessing that if you have applied for a job that is actually at your level, okay? Another important factor is actually supervision as well. Hospitals must determine whether they can have the capacity to supervise an IMG or not, okay, to make sure that they keep a safe service delivery. And one of the biggest problems in Australia right now, especially for IMGs, is actually supervision, right? So that's why hospitals are actually struggling to hire because they require supervision. So if we're talking about level 1 supervision, this is, you know, it's a robust type of supervision. And hospitals are really struggling with that right now. Hence the reason, unfortunately, other candidates have the upper hand. For example, candidates that have studied in Australia or have they have experience into the Australian system and so on, okay? So when hospitals, they review the applications, they are actually assessing your readiness, supervision requirements, and fit for their service, okay? So how are we doing? Are we doing okay? Is it making sense? Let me know, put the thumbs up for me on the chat so that I know that this is actually landing for you guys. Perfect, okay, diving deep. Nadia, okay, I've worked with her before. Yes, from the Philippines. All right, guys. So what hospitals actually evaluate? Okay, so this is where positioning becomes extremely important. So what hospitals interpret as your positioning? So positioning is actually your background, your training, your eligibility when they review your applications. So they are actually evaluating risk, supervision requirements, and whether the doctor fits the service environment. Clinical reasons, again, another very important thing when they are evaluating your applications. Is extremely important when they are making hiring decisions, okay? Especially if doctors have gaps into their practice. That's something that interferes hugely when they are making decisions, okay? So it's important that when you are submitting an application that you signal your eligibility very clearly on your CV. What I see all the time is IMGs, they'll send me their CVs and, you know, their AMC is going to be under certifications. Their English test is going to be under certification somewhere down the bottom on their CV. Their visa status, it's inexistent. They don't add that to their CV. Their APRA pathway, somewhere lost in their CV to be seen. So you need to have in mind that it's really important to signal your eligibility at the start so that when they open up your application, they can see that straight away. So the important things to be very clear about, I'm going to repeat again, is your AMC progress, your English test results, your APRA pathway, and your visa status, okay? And the biggest issue that I see all the time, doctors applying at the wrong level, happens all the time. Usually when I'm working with an IMG, the first thing that I do is to ask them to send me all the links of the jobs that they have applied for, or the ones that they are intending to apply. And what I see all the time is IMGs that's supposed to be applying for SHO, AMO, RMOs, JMO roles, applying for registrar level, for example, right? There is a mismatch, okay? Usually that happens mostly because there is, it's very difficult to actually grasp how the adverts are actually written. That's why usually the confusion comes from, okay? Which I'll dive in a little bit more when I talk about the mistakes. So if you have a really good positioning, right? Not just about your eligibility, which is really, really important, but about your experience in background, your training, and so on. If you position yourself properly, that can really increase your chances of being shortlisted in a pool that is actually massive, right? It's a massive pool. So I would say that 95% of doctors are actually not doing their positioning properly. So if you start doing that with some career mapping, understanding where you are and what you need to do in order to become employable, over time, you're going to increase your chances massively. Okay, so how applications are actually filtered out when the whole, okay, pathways, okay, what the hospitals evaluate, so what, how your applications actually get filtered out by the hospital. So most hospitals, they receive many, many, many applications, as we know, okay? So it first gets filtered out when you are actually answering the screening questions at the beginning, okay? So somebody mentioned on the chat before, looking for a job takes a lot of time, a lot of effort, tailoring CV, cover letters, and so on, okay? So when you are applying for the wrong roles, which I said happens like massively between all IMGs. What happens is when you're first answering your screening questions, and there is a question there about eligibility, and there is a drop down there, and you put there you are eligible for provisional or limited registration, which is most cases here, I'm assuming. And they are looking for somebody that is actually, that, for example, has got 2 years of experience in the Australian medical system. Your application gets filtered out right then, okay? It doesn't even get to see, it doesn't get to the hands of a human person, okay? So what does this mean? That you put a lot of time into tailoring your CV, tailoring your cover letter, writing all the screening questions and so on, and you just get filtered out right then on the first page by the ATS, which is the candidate tracking system, okay? So you put all that energy into your applications, and that haven't even seen by a human, okay? So you need, when I speak to IMGs, I always tell them, you need to apply for the right roles, because if you're applying for the right level, what happens is, and you are positioning yourself properly, what's going to happen is it's more than likely that your application is going to reach a human person, okay? And that is what we are trying to achieve. You want them to get to a human person. And because they are dealing with so many applications, they use the ATS system to filter everything, okay? But let's say your application got to a human person. What do they want to see, okay? They want to see your reasons of practice. That is very important. They want to make sure that you're actually signaling the right pathway, English tests, and so on, things that we have discussed. They want to see that you are applying at the right level, okay? And what does this mean? That your current experience must match what they are looking for. And they are also looking at supervision, okay? Do we have supervision available to this candidate? Can we bring them on board and make sure that our environment is safe? So how is it landing? Be interesting to hear from you guys, see how this is landing for you. Give me the thumbs up to let me know if it's making sense. I'm just trying to get to the chat here. I actually don't know what's happening. Okay, chat, let's see. I'm just trying to get to the bottom. Yeah, okay. Yes, that's great. Good, Ellie. So now, how so many applications actually get rejected? So the first and most important point is usually eligibility is actually not on their CV or is all over. So if you imagine like you have one recruiter to screen 200, 300 CVs, if they decide to do it, if you haven't been screened out from the beginning from the ATS, the information is to be very on the top and very clear for them, right? So that they actually see your eligibility and they are like, okay, this person is good to go. Another point is clinical experience. When it's not explained properly and it becomes difficult for the hospital to understand what you are actually doing. Okay, so it's really important that you have your experience very well explained, what you do in your role and everything, so that the hospital can interpret it in a way that they can basically see it in their own eyes, which is the eyes from the Australian system, okay? So another reason why applications get rejected is actually the level, as I mentioned before. What I see happening a lot, again, is candidates not applying for the right level, which is going to filter out straight away. Uncertainty around supervision. And hospitals will always prioritize candidates that are actually, that have the experience or more aligned with the Australian medical system. Okay, so this means that, you know, unfortunately, you know, doctors maybe from other countries like UK, Canada, Ireland, they will get the upper hand just because their qualifications is just more, it is more similar, let's say, in a way, to the Australian medical system. Okay. So if your application is sent out and if it creates uncertainty to the hospital, they will unfortunately not shortlist that candidate. And they will be obviously prioritizing candidates that show that they are more clearly aligned with the Australian medical system. And the biggest mistakes that I see happening all the time. So the pattern is always the same between IMGs, unfortunately. So what happens is the first one is the level again. Applying for roles that is not your level will lead to rejection, unfortunately. Applications that are not clearly signaling their eligibility in terms of everything that we have discussed, your AMC progress, your English test results, your APRA pathway, and your visa status. And the pathway is really, really important. You need to signal your pathway really, really well, because the pathway will be what's going to tell them the level of supervision that you require. Okay. And gaps in recence of practice. That's another big one. I've seen a lot of IMGs struggling with recence of practice. So it's really important to understand the gap that you have, if you have any, in terms of recence of practice, and make sure that you are getting that underway. I've come across many IMGs that base themselves in Australia. They are looking for jobs for a long, long time. They aren't being successful, and that gap starts becoming bigger, bigger, and bigger. So there is a massive point of attention. Okay, a lot of people do need to return to their countries to work in recence of practice, to put that in their CV, in their applications, so that they are seen differently by the recruiters, you know, medical directors, and so on. So it's a really important point to pay attention to that. And also generic applications. If you have one CV that's all over the place and you are sending that CV everywhere, unfortunately, things will not change for you. If you are being rejected all the time and you keep sending the same application without positioning yourself properly, without mapping your career, it's pointless. You're just wasting your time and your energy in something that will not bring you results. We need to also keep in mind that the system is becoming more and more competitive every year. Every year we have more people passing AMCs. Every year we are going to have more people passing AMC2. And that's going to become even more competitive than what it is right now. And one thing that you need to keep in mind is, in Australia, safety is the most important thing. So they are always going to go for the candidate that is safer for them to actually employ. Okay, so we have many, many people here today. So it's really, really, really important that you understand that you have to plan your career and time it correctly, because Australia is not about emotionally applying for jobs and seeing if it's gonna hit. Australia is not a lottery. So if you are treating your job search like a lottery, unfortunately, you are not going to succeed. But if you are strategic about understanding the system, understanding where you are, map everything that you need to do, and be patient and resilient, these are the only IMGs that are actually going to succeed in an immensely competitive environment, okay? That gets even more competitive every day. So how to make your application stronger? So focus in positioning, focus in making your applications, focus first in applying for the right jobs. Because if you are applying for the right jobs, you're not going to be applying for 200 jobs per year, okay? For IMGs, going through the standard pathway, there are two important things to understand. You need to know that every state will have their campaigns throughout of the year, right? So you are going to apply for those campaigns that you are actually eligible for, as long as they are okay to provide visa and supervision. So you need to do your research, find out when the different campaigns are taking place for IMGs that are actually offshore, and prepare for those. What's going to happen throughout the year after that is some people that got those jobs, right, that they applied through the campaigns, they are going to start leaving for different reasons. People will have personal reasons, they will not like the job, their circumstance changes, and they will leave the job during the year. And this is when you're going to see new positions coming up, because how they do it is like medical directors and HR departments, they do their workforce planning for the next 12 months. They work out their budgets. They will do a major campaign. They will recruit everybody. They will have supervision for everyone. And this is their recruitment done. Throughout of the year, people are going to start leaving those jobs, and they are going to be advertised, and you need to pay attention to the ads so that you apply for the right roles. The thing is, there want to be 200 jobs, okay? And I know this is something that is probably hard to hear, but there will not be 200 jobs for you to apply for. So if somebody comes to me, I've applied for 60 jobs, 200 jobs, I know they are totally applying for the wrong jobs. So it's important that you understand that, and you are ready for the ones that really make sense for you, okay? If there are no jobs for you to apply for right now, no problems. Let's see what I can improve right now that will increase my chances when that job opening opens for me, okay? So don't waste your time rewriting your cover letter, rewriting your CV, and applying for a job that is actually asking for somebody that has got 2 years of experience in the Australian system. You're going to be rejected right away, okay? And I like to be honest with IMGs, because I know there's a lot of expectations that are created about finding jobs. But if you do things right, you're going to actually increase your chances, and you're going to feel less burnt out throughout the process, okay? And your expectations are going to be more manageable. You're not going to be in a situation where you think there's something wrong with you, thinking that you are a problem, that this is not going to ever happen for you. Because when this is happening in your mind, it's just because you actually don't have an understanding of how this system works. Once you start understanding how the system works, how to strengthen your applications and the right jobs that you need to apply for, your chances are actually going to increase, okay? So positioning is important. Applying at the right level is very important. Understanding jobs advertisements is the key, because this is where everybody is falling off the wagon, okay? So clearly demonstrating your eligibility. And one thing that's going to be making a massive difference for you is actually passing AMC 2, okay? I know there is a lot of fear around the test. This is why Aaron is here today. But passing AMC to clinical means readiness, okay? It's not just the exam. The exam is a plus on the top of everything that I've discussed with you here, guys, today, okay? Because it's not just one thing, it is a number of things that need to come together so that you get your first job in Australia, okay? I hope this information has been helpful for you. I'll be passing on to Aaron right now. He's gonna start his presentation. And stay tuned, stay here with us because you're gonna be answering your questions, okay? Towards the end of this webinar. And I hope this content has been useful for you. Thank you so much for staying here and listening. So Aaron, I'll be passing the controls to you now.
All right, thanks, Francine. I'm really happy to be here. Thanks for you guys, coming and spending the evening with us. So I'm Aaron's. I was actually born in Malaysia. So I migrated from Malaysia back in 2019. It was a very, very difficult journey. And it took me almost 3 years to secure my first job. And in 2021, I got my first job with limited registration. And then, it was very challenging navigating the hospital in order to fulfill the requirements for general registration. But after a year, I got my general registration. And then another challenge came, the permanent residency. Yeah, it took some time to get the permanent residency, and then I was free. I was free as a free practitioner in Australia. So I thought that I achieved my goals, to work in Australia. And then I was working in the hospital. I was doing a lot of locums, and I was quite happy. I was trying to think, one of the reasons why I came to Australia was to make a good income. And yes, I was doing quite well financially. When I was locuming at the hospital, one day I can do about 2,000 Aussie dollars. And I do 20 days in a calendar month. And I was making 40,000 Aussie dollars per month. And there I thought I was successful. However, after a few months, few years, something was wrong. I felt it wasn't what I wanted. It wasn't who I wanted to be. It did not align with the hospitals. I was working so many hours. I hated working the night shift. It was horrible. And then I thought to myself, success without fulfillment is the ultimate failure. So you can come to Australia and you can aim to make better incomes than what you had been making in your own country. And then you can also be unsatisfied. Okay, so my role here is to guide you, to provide some awareness today. All right, so why I'm speaking to you is because after going through the entire journey, it took me almost 4 to 5 years before I was free to practice on my own. Today, I'm very fulfilled. I have my own private practice. I'm innovating in telehealth medicine in Australia. I'm not sure if some of you have heard that, but it's a very, very promising healthcare. It's recognized by APRA. It's one of those leading innovations that we can, delve in the healthcare space. And you know why? Because in rural hospitals or rural areas, you don't have facilities or infrastructures like clinics, but the internet reaches the rural area. So people are getting increased healthcare from there. All right, so I have business partners. I work with lawyers, legal lawyers, because the healthcare space, it's heavily guarded by medical legal conditionings. Okay, so you need to be very aware of what you're getting into. All right, so I'm going to share my slide. Okay, can you see this? Give me a thumbs up or put yes on the comment if you can see this. So that's a bit about myself. So basically, I'm practicing in Australia. I'm currently living in Melbourne. And going back, when I started reflecting on my entire journey, it was really hard. It was like staring into an abyss. Abyss is like an entirely dark area. You can't see the end of it. There's no light. It felt like that. I wasn't sure if I was going to be successful. I wasn't sure if I could actually secure a job. And after 245 applications, I got 6 interviews. And out of the 6 interviews, I secured my first job. And that's like very hard. It was very, very hard. So what I did after that, once I've settled, I looked at some of my colleagues. They were all moving, they were getting their general registration. They were going into specialist trainings. And I told myself, like, I can't just sit back and let others go through the abyss without any guidance, without any awareness. So I went in very deep into understanding why there is so much confusion, why there's so much lack of clarity, and why there's so convoluted, the system. I've read every single report that Australia produces, for all the stakeholders to tighten up the system, to improve the navigating the pathway. All right, so I've joined the AMC in 2022. They had a position for a member advisor. At that time, they were doing a project called an advisory group for international medical doctors. There were 600 applicants and only 3 were selected. And I was one of them. So I have a very, very deep understanding. And one of my values is to provide meaningful work. And that's what I'm doing here. Okay. So if you look, today I'm also helping international doctors as a career strategies, how to transition into Australian practice. Once you got your registration, once you're working, there can also be a lot of challenges. And of course, my favorite, I coach candidates for the clinical exam, and I provide them strategies on how to be successful. And I also, produce writings like the Successful Doctor newsletter, and I've spoken at the international conference organized by the AMC. So with the AMC, we do meetings like every 2 to 3 months. Okay, this is just a slide to show you like how a meeting would look like. This is how some of the high level meetings that I go to with the Australian Medical Council. The pathway is very complex. There's 6 stakeholders. If you look at this slide, in one of those meetings that we had back in the year 2023, we have APRA here, Director Tonkin. She was there. The rest of it is mostly from the Australian Medical Council. And this here is a person who I'm going to talk to you about in the next few slides. She's Robin AO. She's an independent reporter that the Australian government have appointed to produce a document on the entire international medical graduate pathway. It incorporates all the healthcare professionals coming into Australia, and she produced a very comprehensive document. It's 123 pages long. Have anybody here read the Crook report? Do you know what's the Crook report? Okay, so I'm just going to show it to you. So this is one of the pages of the Crook report demonstrating the pathway for the standard pathway, the competent authority pathway, and the specialist pathway. You don't have to be worried about what's the content in there. I just want you to know it's very complex. Okay, if some of you have written in the chat down there, I can see it's very confusing. It's almost like you're not sure what's going to happen to you. It's very true. Because if you look at the diagram there, it's not only very lengthy, it's also very time consuming. All right. And if you're able to squint and see some of the numberings there, there's 13 steps here. Okay. And the steps are also labeled in colors. And if you really look at it, more than 80% of the journey is challenging. Even Robin Crook herself have mentioned it in the report. How interesting. Okay, I just want you to know that this journey is not a walking on in a bed of roses. Okay, you have to be prepared. And that's why I want to talk to you about this, okay, the success gap and about the AMC clinical exam. All right, so who here can tell me what success is? What success means to you? Do you know what success is? Is it important to know what success is? Because if you don't know what success is, then how would you know if you've achieved it? Okay? So for you who's beginning, you can think of it this way. What you have to aim here is your general registration. Okay, once you attain the general registration, your standard would be almost equal to the local graduates here in Australia. Okay, it's almost, because you do have to get other things as well. All right, so the other thing I want to tell you, that you know the journey is tough. Now, I want to ask you this. Why is there some people who are successful and why there are so many people who are not successful? What is the difference? Why is someone very successful and why there's a group of people, or majority of them, are not able to achieve success? What's the difference? Okay, somebody said persistence, perseverance, consistency. Very good. Is that all you need? If you are very persistent, will you be guaranteed success? So I will share with you some of the gaps that you need to fill in order to be very successful. Okay, there is a definition of success. Okay, who can tell me here what is the definition of success? What is a definition of success that can be applied universally to everyone, whether you're a doctor, teacher, fisherman, whatever you are? What is success? There is a very simple definition. Okay, so success is really the ability to design the life that you want. That's it. It's just the ability to design the life that you want. That is why you are here. Otherwise, you'll be practicing in your home country. You don't have to come to Australia. There is something that you are looking for, that you are trying to fulfill. Okay, so now I want to ask you, how can you achieve your dreams? What do you need? What is the component that is essential in the recipe for success in order for you to design the life that you want? Of course, persistent, consistency, but there's something very important. Napoleon Hill is the author of the book called Think and Grow Rich. He have done a survey and interviewed 500 billionaires and millionaires in the United States in the 19th and 20th century. And you know what he found? That the number one component of success is a burning desire. For those of you who really want to be successful in migrating to Australia as a medical practitioner, you must have a burning desire. That is the beginning of all wealth. Okay, a burning desire. So I'm going to get you to think in this webinar. Okay, you need to think, because there is a difference. Okay, you can just get all the information, but everybody has information today. Today we are no longer in the information age. We are moving into a modern age. It's called the machine age or the AI age. Okay, the artificial intelligent age. So information is no longer going to protect you. It's no longer going to support you. You need to have the ability to think on your feet. That's what's going to make that difference. Okay, and a burning desire to achieve your goal, no matter how deep you are in the abyss of this journey. All right, I'm going back to the slides. All right, so now I want you to think about your why. Okay, Simon Sinek, he's a philosopher. He always say, start with the why. Your burning desire must have a why. Okay, so these are some of the whys some of the IMGs use or have when they come to Australia. Can you put down in the chat, what is your why? Why? Why do you want to come to Australia? Why do you want to be practicing medicine in this country? What is your reason? By the way, these words here is accumulation of some of the reasons why international medical graduates choose Australia based on the report or the survey that was produced by the Australian Medical Council in the year 2024. Okay? So keep showing me your whys. Why do you want to be here? Some people come here for income. Some people come here for security. Some people come here for, to have a better life with their family, career progress, family progress, better education for their children. What is your why? You need to be really, really clear about this. Otherwise, whatever comes next in your journey is not going to help you. You're going to be easily swayed away. Okay? So career growth, work-life balance, all right? So you need to hold on to your why. And I will share with you some of the gaps that you need to fill, okay? Because everybody is a little bit different. When I share information with 10 different people, not everyone will be successful. There's a difference in that, and I'll get to it. Okay, so I want to show you the next thing is, can you guess what is the top reason people come to Australia? What is the number one reason people choose Australia? So if you look at this slide here, the biggest words are the top reasons, okay? So based on the same survey done by the Australian Medical Council, 34% of IMG chooses Australia for the economic reasons, okay? Because you have better income. In fact, it's one of the highest earning salary paid job for doctors in the world. It's obviously higher than the UK. It's very clearly higher than the UK. And in some instance, some people say that the level of intern here, the interns earn a lot more than the registrars earn in the UK. So some of the doctors who plans to, do extra training in the United Kingdom, they are quite concerned about the salaries when they work in the UK. All right. So the economic reason is the top reason, and the other reasons are also quite compelling, right? Family, work environment. There is a fair work rights in Australia. If you're not sure, that's something that the Australian work culture really takes really strongly about. You can't just scream and shout at anyone in the workplace. Then you'll be attended by the people who are from the fair work rights. This slide here is to demonstrate that you are very important as an international doctor. 42% of the healthcare workforce in Australia comprise of international doctors. Okay, so if you're working in Australia, if anyone, especially the local graduates, come and tell you that you're not important, what's the real truth. Okay, and you can either ignore that, or you can tell them in your own way to fly kite. Okay, because you are very, very important. Without international doctors, the healthcare system here will not be very stable. And that's why they hired Robin Crook to do those reports, because they need doctors. They need internationally qualified healthcare practitioners in Australia. Now, I want to ask you this question. What do you think the chances are going to look like in the next 10 to 20 years? Are they going to need more doctors, or are they going to need less doctors? Make a guess. Less doctors or more doctors? So why less doctors and why more doctors? If it's less, why less? If it's more, why more? What's the reason for those things? You need to be very clear. Okay? So Tin says less, Helen says less. There's a few coming in with more. Somebody said there's AI involved. YouTube says less. So what are you going to do? Where are you going to get the right information from? So let me tell you. The truth is, okay, based on this study here, I want to just show you. Okay, if you can see this on the screen. Based on this study that is conducted by the Australian government, Department of Health and Aged Care, this is the projected supply versus demand for general practitioner, full-time employee. They predict that there's going to be an unmet demand, massive unmet demand by the year 2048. Can you see this? In the year 2048, this curve, the dark one, is going to be the demand. This is where the supply is predicted. Okay, we are doing around here, 2026. It is forecasted that the Australian population is going to increase because of various reasons. There's immigration inward into the country. Obviously, the population within the country is also going to increase. And the other thing is healthcare is going to be more and more required. And the other reason is that people are living longer. When I was in Base Coast Health Hospital as a medical registrar, I had a patient who was walking and he was 101 years old. You're going to see more of them. So that's why those predictions are coming in. All right. So yes, the opportunity is going to be good. You need to be absolutely clear about this. AI is going to be present, but nobody is going to take advice from an AI and put their life on it. I can assure you that, at least not in the next 50 years, until we have data and statistics of how artificial intelligence impact humanity in a better way. But right now, people want human advice. If someone is having cancer, they don't want the robots to tell them that everything is going to be okay. Yeah, I don't think you want that too. All right, so don't be too concerned. The answer is more demand. Okay, so you can see here, this is a clear curve here. So next, I want to talk to you about this. What is the cost? Okay, what is it going to cost you to make the migration journey in Australia? Do you have any idea? Okay, there's going to be costs, yeah? You're going to have to spend your time. Obviously, it's going to take a lot of time. Somebody said time and money. Absolutely right. Time and money. And what is the other cost to you? There's another cost. There's one more. You need to be very clear about this. The other one is identity. Okay, when you come into Australia, sometimes you need to go back down. You might be a practicing specialist. All right, there was one of the surveys and one of the publications I read. There was a head of department who was working as a head of department in Singapore. And he was saying that when he came to Australia, he had to start back as an undergraduate level, starting back as a resident medical officer. Yeah, that's a toll for you as well. Yeah, don't forget that. Sometimes that's the sacrifice it takes when you're making this migration journey. It's not always completely transferable. All right, so I want to talk to you about the money. Yeah, somebody was saying there, Nada. Thank you for putting that in. $12,000 minimum, 25,000 is a safety net. Any other guess? What are the other guess here? Like how much money is it going to cost you? Make a guess, make an intelligent guess. I mean, you guys are here, you are going to go through this journey. I don't want you to be worried, thinking that you are doing more than what others are doing. You need to be very clear. Clarity is ultimately the reason why you're going to succeed. Very true. It does depend on family size. Okay, that's true. 60,000 Aussie USD. If you have 60,000 USD, then you are pretty good. Obviously that will give you a good buffer. So the other thing I want to talk about is time. Do you know, based on the survey conducted by Robin Crook, she found that it takes an average of 1 year. But in contrast to that, from the survey report done by the Australian Medical Council, on average, it takes an international doctor about 3 to 5 years to secure their first employment. Okay, and some of the struggles is with all the duplicative process, your English exams, your health examinations, you have to do that with the Home Affairs Department, your immigration, health clearance, all this duplicative process, recency of practice, all of that will accumulate and cause gaps, time gaps. Okay, you have to be aware. The other thing that we found is that it takes women longer than men to travel this journey because of family. All right, so be aware of all this. Okay, if you have any aha moments, please write that down. If you're clear about this, your chance of becoming successful is highly higher. Okay, I find that in all my coaching clients, once they are aware and they can make an informed decision, their worry comes significantly down and they can focus on their dreams, and that makes them successful. All right, so now we have already seen time, money, and identity. These are some of the words that Robin Crook found from the surveys that she have made. She have conducted about 200 meetings. Over 186 hours she have spent interviewing people. And this is some of the things that international graduate says: demoralizing, slow, impossible. I saw in the chat in the beginning, somebody said stressful. Somebody said frustrating, confusing. Very true. It is very dissatisfying. You see the word dissatisfied, I put it twice because I myself is very dissatisfied with this. Otherwise, I won't be here. I won't be wasting my time in the international, with the conference with the Australian Medical Council. I cannot allow others to go through the same hell. Why do the journey needs to be the same way? Can't we improve? Everything has been improving. If you look at the cars, today we have electric cars. We have ABS systems. We have all kinds of technology coming in. The humankind is improving in all sort of dimensions. But the international medical graduate pathway is a bit deflated. It's a bit on the slow end. I won't allow that. We need to change this. Okay, that's what I'm doing here. I want to create awareness in you first before you understand the gaps that it takes. Okay, so just be aware that if you are experiencing any of this here on the screen, you are not alone. You need to strategize. You need to work on yourself, okay, inner self. You need to have a high level of self-awareness. That self-awareness will push you towards your next challenge, okay? So here, I just want to demonstrate to you, based on the reports on the cost. Okay, this slide, if you look at the left here, the leftmost, international doctor spends up to about $50,000. Okay, 50,880. This was the report done by the independent regulatory setting, the Department of Finance. Okay, this was a 2023 report, and they conducted a study. This was shown in Accenture. Robin Crook put this up. On average, 75 percentile of people spend up to 50,000 Aussie dollars. That's a lot of money. And then on this side, on the right side, it takes people about $5,000 to $12,500, okay, on registration and migration costs. Okay, all your English tests and health assessment. Okay, it's a lot of money. You know what's the issue here? If some people I've seen on some of the journals and some of the publications, one person spent the entire life savings up to 100,000 Aussie dollars. That happens when someone is not aware of what is the standard. Okay, if they are worried and they're just spending money here and there and getting all kinds of advice, then yes, it will go beyond the 75 percentile, up to the 99 percentile, which is not included in this study. But yes, it is a lot of money. You need to strategically invest in yourself and in your career if you really have that burning desire to be here in Australia. Okay. Now, I'm going to talk to you about the AMC clinical exam. All right, I'm going to go into the clinical exam. Right now, I've shared with you all of the problems, all of the challenges. Okay, have I shared it in the way that it's clear? Do you follow what I said so far? Let me know in the chat if you really understand what was conveyed. Okay, thank you. Teen, Nada, Priya, thank you. Okay, these are really important because once you know the challenge, it is very likely you're not going to be shaken when you encounter an obstacle along this journey. Okay. Now, with the AMC clinical examination, do you know that based on the survey that the Australian Medical Council conducted, it is the second biggest reason of delay for the standard pathway? IMG is navigating the standard pathway find that the AMC clinical exam is the second biggest barrier to their challenge, to their journey. Okay, if some of you are specialists over here and intending to go into the specialist pathway, if you are deemed not comparable, you can either exit and forget Australia, or you have the option to come through the standard pathway. And here again, the clinical exam will be your second biggest challenge. What is the first, number one biggest challenge for international medical graduate? Who can tell me that? Who here knows what is the number one challenge, the number one reason for a lot of money, time, and identity cost? What is the number one reason for the delays? Then what is the number one reason for an IMG? We say the AMC clinical exam is the second toughest barrier. What is the first barrier? What is the first most challenging? Okay, somebody said visa, sponsorship, very close. The sponsorship is getting there. Securing the first job. Helen, well done. That is the number one reason. Okay, 60% of IMGs are delayed by not able to secure their first job. Okay, well done, Helen. That's right. All right, so you need to be aware of that. So 55%, that means almost 1 in 2 people will be delayed. On average, we found that it takes, on average, IMG takes about 3 to 5 years to clear their AMC clinical exam. And it takes about 3 to 5 attempts on average for someone to clear their AMC clinical exam. The good news is that the AMC have dropped the price. It used to be almost 3,900, but now it's about 3,000 Aussie dollars. So, but still, if you're doing it 3 times, it's quite a lot of money. Do you know what's the cost of the WBA program? How much does it take for you to pay if you join the WBA program? Okay, very close. Yeah, 10,000 is the right answer. Okay, it really depends on the hospital. And WBA is the alternative to AMC clinical exam. But what's the problem? Why not everybody just go into WBA? Why is that not happening? Do you know the answer to that? Who can tell me the answer to that? Why not 100% of all the IMGs goes into WBA? Limited seats, very true. How many seats exactly? How many seats are there right now in the WBA program? Okay, it's about 10% capacity of the AMC clinical exam. It's about 300 right now. It's increasing. 2 years ago, it was about 159. The AMC is working very hard with the hospitals. It is very resource intensive. The hospital have to spend a lot of money. And there's a lot of limitations with acquiring specialists who's able to guide people. Okay, but it is one of the most successful programs out there to get IMGs to secure, to work or integrate in the healthcare system. Do you know that the passing rate for WBA is 99%? It's very high. But the issue with WBA is that you only have 300 capacity there per year. And the other thing that hospitals are doing is they are checking, because there's a high amount of competition, right? And not every hospital have 300. They only have about, it's less than 100. It's probably about somewhere in the range between 20 to 30 doctors that they can support in each hospital network. Because of that high competition, they are filtering out people who have done the AMC clinical exam first. And some of them, after 1 or 2 attempts of the clinical exam, then they get selected into the WBA program. Okay, so you need to be aware of that. Hospitals will ask you if you have done your clinical exam before they consider you on WBA. And yes, not every hospital has WBA programs, okay? So that's why it's very challenging. That's why it's really, really hard. First of all, you need to secure a job in the hospital that offers WBA program. Then you get into the WBA program. And on top of that, you already know 60% of people are delayed from securing the first job. So you can see the challenges of WBA. So the AMC exam, the good thing about the AMC exam is that the capacity that the Australian Medical Council, through their new exam center in Docklands, they have a capacity to run 3,000 candidates. Okay, apologies, 3,000 candidates per year. In one exam cycle, they can do about 20 candidates. So the good thing is the turnover is quicker. The cost is cheaper if you are strategizing this correctly. And if you do the right things, if you understand yourself and you understand the gap that I'm talking about, if you pass this, it will mean that you get provisional registration. It will mean that your chances of securing level 2 supervision is a lot higher. If you have level 2 supervision, you can do night shifts. You can work under indirect supervision. Hospitals will be, loving you because you're more favorable. Okay, so I want to demonstrate that point. So between the AMC clinical exam and the WBA program, okay, there is a difference. AMC is the quicker way, all right? Clinical exam is the quicker way. If you want to shorten your time, you have to do both together. Apply for hospitals that have WBA program and aim for the clinical exam. That's how I coach my clients. What is the passing rate of the AMC clinical exam? Do you know? This is important to know, yeah, because if you're planning to do the AMC clinical exam, you need to be ready for this. It shouldn't come to you as a shock. So what is the passing rate of the clinical exam? Somebody is saying 20%, 24%, Hinok, 22 to 28%. Okay, so very, very close. In the last 5 years, it was less than 25%. Last year, we did 24%. So let me give you an absolute number, how it sounds like. In 1 year, the AMC does about 2,900 candidates. And out of that, close to 500 people pass the clinical exam. When I was in the performance advisory group, as a member advisor, we managed to bring the score from 10 out of 14 stations to 9 out of 14 stations, but we are still seeing around the same pattern, okay, around 24 to 25%. And Julia, there is a lot of reasons for that, and I'd like to talk to you about this, okay? So first of all, I was trying to find the answer myself, okay? I passed my clinical exam on one go, but it wasn't that simple. It wasn't that easy. There was a lot of things that I had to understand myself. I went for a bridging course, and in my bridging course, there was 15 people in there, but after 5 years, only 3 of us have passed the exam. And when I went into the bridging course, they were telling us that if you go into a bridging course, your chances of succeeding is a lot higher. Now I know it's not true. Bridging course provides information, but that information is not going to help if you don't have your foundations very clear. Okay, I'm going to share with you the reasons. Okay, see, one of those things that I did, I tried to look into some of the publications. Professor Liz McFarmer, she is one of the clinical exam examiners. She's also one of the examiners in the clinical exam division who design questions and study about producing a rightful question. They work very closely with Monash University in Australia and Melbourne. And they try to produce the question, they try to study the behavior of examiners. And in 2012, she published a very nice article to explain the reasons why the pass rate for international doctors are much lower. And on average, among all the studies that I've seen, I've also compared the studies with the Canadian international exam, and the passing rates of international doctors is always lower. And one of the studies done by the Family Medical Practice in Quebec, Canada, they found that the international doctors, they tend to score between 1.5 to 2 standard deviations compared to the local graduates. And in the ASAM, the Australasian College of Emergency Medicine, they did a survey between international doctors and local graduates. They found that for the same exam, international graduates passing rate on an average is 13.5% versus the local graduate scores about 70%. Okay, so it is a sort of, there's a big difference. Okay, there's something with the international doctors that are producing the low passing rates. Okay, and I'm going to talk about that. Okay, if you can see this slide here, who can tell me what is this? I'm sure as a doctor, you will definitely know this by heart right now. The fight, flight, or freeze response. Okay, that's obviously, that's the autonomic response. Okay, is that, yeah, somebody said that correctly, is the sympathetic nervous system. When I was trying to understand why people are successful, why 24% of people are successful in the AMC exam? Why are there some people are successful? And be mindful here. I'm not saying that the local graduates, all of them are going to pass their exam. Okay, they're not scoring 100%, but they score higher. It's all got to do with the learning environment. Okay, and how you are taught, your self-awareness, your belief systems, the way you conduct yourself, all of that plays an important role in doing this international exam. This is a high stakes exam. It's a very high stakes exam. The journey is not the same as a local graduate. The local graduate here, when they come from any country, some of them are from different country. I had one colleague of mine who came from Malaysia and studied in Australia. And when I look at the local graduates, the way that they get trained, the way that their specialists teach them, and what they have is 5 to 6 years of time to learn about the healthcare environment, to learn about the system. And for them, the journey is very different. They know exactly what is expected out of the exams. And for an international doctor, I showed you the journey map, right? You saw how much of challenges there. In their mind, in the mind of an international doctor, is not only the exam that is going on. There is psychosocial stresses, life stresses, family stresses, recency of practice stresses, whether they have practiced enough, identity stresses. I became a specialist. Now I'm doing the clinical exam. It's general practice all over again. Have I prepared enough? Can I do this? What if I fail? These are the reasons why that system there on the slide is triggered, is activated, because on average, it is very hard for an international doctor to balance and juggle a lot of balls in the air. It's very hard to do that. And that's why I'm trying to tell you that the gap, you need to be very clear. You need to understand, if you're going for the clinical exam, you need to be 100%. You need to know who you are. You need to know what are your pain points, what are your triggers, what trigger your anxiety reflex, what triggers your sympathetic reflex. This is a big problem in the AMC clinical exam. I am a mock examiner. I work with a lot of clients as well. And recently I've done a master class, speaking to one of the AMC clinical examiner, Dr. Sarah. She had 10 years of experience examining clients or candidates. And we find the answer to be the same. Is people, they are not performing the exam at the level that is expected out of them. They have a certain set of belief. I can tell you all the things that you need to do, but if you don't have a good foundation, if your awareness is not good, your belief system is not good, if you're going to have a negative talk with yourself, if you're going to have the pessimist mindset, it's going to be very, very hard. And what if I tell you that if you change this belief, your life will change? You can change your exam outcome. What if I tell you that? And what if I tell you that if you know how to manage yourself, that will change? What will you do? How would you do things differently?
Last 5 minutes.
Running out of time.
We already passed 45 minutes.
Okay, just for the sake of time, I'll be very quick here. There is two systems here. There is the conscious mind and the subconscious mind. The subconscious mind is the real deep mind, is the mind that triggers the reflex. It is who you are when the stress response kicks in. You need to be very clear of that, okay? And when you study textbooks or when you prepare for the AMC exam, a lot of that information that you absorb is just information. And when you have stress, what happens is that your conscious mind kicks in. Your conscious mind strips off all that information. Okay, so what I'm trying to tell you here is that you cannot only use IQ to pass this exam. IQ is really coming from your conscious mind. You need to use your belief system that you can do it. You need to have a positive mindset. And when you really train with that mindset, then your foundation is very strong. You can manage anything that comes in your way. All right, so I'm just going to go quickly into the next thing here. This is what I find to be the most important thing, okay? The complete construct of a successful mindset. People who prepare for the AMC exam, they only focus on these three things: strategy, tactics, and skills and mindset. This is where your bridging course comes from. They give you slides after slides after slides, a few role plays, but they don't tell you that you need to work on yourself, your belief system, your values. What do you believe? Are you someone who can take any challenges? Are you someone who can beat any obstacles? You need to be very clear. What is your, what type of addiction you have? Do you just read textbook or do you do the right thing? Do you do role-playing practice? If you do the right things, if you have a very strong foundation, just like a tall building, if the foundations are deep inside the ground, the building will be very steady. Okay, and then when you have the strategies and tactics, it will work for you. That principle will work for you. Here, I just want to point out to you, to pass the AMC clinical exam, you need to score 9 out of 14 station, and the scoring is based on the global rating. It's how an examiner sees you, the impression that they have. If they think that this doctor can perform successfully, can be very safe in the Australian healthcare system, they will give you a pass global rating. This slide is just to demonstrate the difference between a passing score and a failing score. On the left here, you can see that in order to pass, you need to score 4 out of 7 per station. And if some of them who failed, the score looks like this. Okay, they score less than 4, they fail. But here's the key point: the global rating is not a numerical, like an addition. It's not an addition. Look at this. If you look at the fail score, there's 4 domains here. This person has scored 4 in the first domain, approach to patients, second 4, the third one 5, and the last one, management plan, they scored 3. If you do the maths, 4 plus 4 plus 5 plus 3, it's 16. You divide by 4, it's supposed to be 4. If you total up this thing and you divide by 4, the average is supposed to be 4. But you see, the person scored 3. So the question is why? This is what they're trying to illustrate. It's not a numerical addition. It's a global impression. The examiner have to see how you perform, and you have to perform at the level that is equivalent to the standard of the local graduates here. Okay, let me talk to you about that. This is the 4 gaps that I find very common. Okay, so the standard gaps, if you look at the first one, the standard of practice, that means you must be culturally safe. You must know how to speak to the patients here. When you do your clinical exam, you must do something called a patient-doctor shared decision making. In most of the Asian culture and where I initially practiced or came from, we used a lot of paternalistic conversation. That means the doctor say, the patient do. In Australia, if you do that, the only thing you get is a fail in the station. Okay, so here you must be very patient-centered. You must be aware of the risk. You must be following what the patient wants. If the patient has cancer, they do not want chemotherapy, you don't force them. You tell them the complication, you tell them the red flag signs, you make a decision, you work with them. Communication gap. Communication is one of the biggest gaps here. Do you know that 80% of medical legal problems in Australia comes from communication? 80% of patients suing doctors is from communication errors. And that's why the AMC is very clear about this. The other thing is strategy. Strategy is like doing role-playing performance. The more you do role plays, the better it works for you. Identity, we've talked about this, okay? If you feel like you're a specialist and now you're coming down to the general practice, you got to just do what it takes, okay? It's hard, it's really hard, but you still have to make sure that you can perform at the level that is required, okay, in order to pass this exam. Now, I'm just going to quickly demonstrate to you our 6 steps method. This method I have discovered, I've worked really hard to figure out how can an international doctor spend half the time to practice. Okay, so there's 6 steps here. Number 1 is the question bank. The reason why question bank is really important is because a lot of international doctors preparing for the exam, they struggle to find a high quality question. One of my clients said that what we do so well at DocRoach is having a stem that looks like the AMC clinical exam. It's a detailed stem. It's not a one-liner. And I learned that word from her, one-liner. The problem with a question that is not good is you're going to waste so much of your time finding the right questions, and wrong questions can lead you the wrong way. You're going to spend time with the AI finding out the answers to it. You're going to waste your time. It's all about performance, okay? Communication and the standards that we talked about. The second one that we have is watching a role-playing video of someone who have passed their exam. This is important because you need to know how success looks like. That's what I've talked to you in the beginning. Role-playing practice is number 3. A lot of role-playing practice is important. So that's why the step number 4 is a routine, a schedule. And in DocRoach, we have something called the role-playing scheduler. All right, the role-playing scheduler or the planner teaches you how to be consistent. The more consistent you are, the better your outcome is going to be. And once you have done the first 4 steps correctly, the last one is going to be, the 5th one is going to be getting feedback. The right feedback will save you so much of time. One mentor can guide you completely in a way that you cannot see. Sometimes you just can't see what you're not doing right. And you need a mentor or a coach to guide you on that. The last step is building confidence. It only comes when you repeat step number 3, 4, and 5 multiple times, then you unlock confidence. Confidence is the final step. That is where your flight, fight, or fright or freeze response is not going to be triggered no matter what you encounter in the station. Okay, this is the clinical accelerator question bank. This is how it looks like, a full stem. And we have 100 questions in here. And this is our role-playing planner. You can see here, it increases the performance of our candidates by 10 times. Initially, they struggled. The first 2 days, they did not do a role play. When they start doing their role plays here, on the 3rd day, they had 26. And by the end of the 4th week, They have done 63 role plays. You can see how the performance increased here. And by the way, this person passed the AMC clinical exam. This is Dr. Vidya. She's one of my coaching clients. This is what she said. Doc Roach gave me the system, the correction, and confidence to finally pass. All right. When I worked with Vidya, she was struggling with many things, but what the biggest challenge for her is time management. And when she went for 2 bridging courses and she failed the exam twice, and the third time when she came to me, I know that she already had all that information. All she needed to do was work on her communication and her time management. And when we focused on that, she passed her exam on her third go. Her third attempt, she passed the exam. And today she's working in Townsville in Queensland. Okay, she's gotten her general registration. Dr. Richa, all right, she's very special because I remembered her. She did not have any clinical experience. She just graduated and she wanted to migrate to Australia from India. And when I coached her, she sounded exactly like a medical student, not a seasoned doctor. So I worked with her. I focused on her communication skills. She failed the exam twice before coming to me. And this is what she said. I love their focus on soft skill, time management, which you build by practicing with their detailed STEM. And she passed the exam on her third attempt. And she had a gap of more than 5 years. And today she went into internship in Australia. I've guided her getting onto that. So this is my last slide. I just want to point out to you, if you're doing the clinical exam, the examiner masterclass mindset, it's going to be very helpful to hear what the examiner wants from you. It's a 1-hour masterclass. It has a question and answer. You can consolidate your understanding. And of course, if you're preparing for the clinical exam, you need the tools. Like what I've shared with you, the tools is the clinical accelerator. All right, thank you for listening.
Thank you so much, Aaron. The information has been extremely valuable. I'm sure everybody found it. How did you find it, guys? Do you want to maybe put it on the comment? I was really impressed with everything that you said. I think it does come down to mindset for sure, but also the preparation is really important, right? I think when you have the right mindset, you are in preparation mode, right? So having the understanding of how the system works, having the understanding that preparation is key. I also think that persistence is something that is invaluable in this process, and understanding that it is a process that takes time, but is more about the person that you are becoming in the process than anything else, because it is about the journey, right? Because it's all about getting better. And the end result, hopefully for everyone, will be to get a job in Australia. I really hope. That's my desire for everybody here. And I think we can start with the Q&A. I received some questions here myself as well. So I'll probably go through my questions and then you can do yours, Aaron. What do you think?
Yep, that sounds good, Francine.
Yeah,
Let's do
okay.
that.
Thank you so much for doing such a great presentation. So I have a few questions here. I'm just going to run through them. Let's see. So what does it mean to be placed on eligibility list? So I believe some people have they have applied for a job and they got an email from the hospital telling them that they've been placed on eligibility list. What does that mean? Usually means that your application was considered suitable, but the hospital doesn't have an immediate vacancy available for you. So they will put you on that list. And hopefully when something comes up that is suitable, they will be in touch. The other question that I have here is, what length of gap is considered a gap? So it really depends, but when it's getting close to that 12 months without any clinical practice, that's when you know, maybe something should be done about it, but it also depends on the context, right? It depends on how this is actually explained on your CV, because the reasons are important in how it's framed. So let's say maybe you've been focusing on CPD, you know, activities, you've been doing research of observerships. So every situation is different. Every IMG is different, and every situation is actually different. So there is need to have an understanding of what your situation is and how that's going to be framed on your CV. But as I mentioned before, reasons is something very, very important and something that hospitals are actually looking at. Okay. So the other question that I have here is, how do we know what level of supervision we should apply for? It actually doesn't happen that way. The level of supervision is actually is a process that happens when you are offered a position in a hospital, and the hospital actually decides through looking at your qualifications, looking at your background, your eligibility, and so on. And then that is decided with APRA, which level of supervision will be required to a specific person. But that comes through getting a job first. The other question that I have here is, how do we convey visa status, especially for offshore candidates? Basically, you need to add it. So in your eligibility, when you add your eligibility into your CV, you just need to specify that you actually require a visa in order to be employed in Australia. That's how usually you'd be conveying that. Can IMGs with limited registration work in private hospitals? So it can happen, but in rare cases, because the public health, the public medical system has got more infrastructure in terms of giving people supervision. So it can happen, but it's not something that you're going to see happening all the time. So hospitals reject candidates with more than 1 year gap. Is that true? So it really depends on the role requirements, I would say, but recency is something really, really important. It's going to depend on the hospital, it's going to depend on the role, and it's going to depend in all the other factors that we actually discussed in my presentation, but also who you are up against, right? You have to think that other candidates are applying for the same roles, and hospitals will tend to choose the ones with less friction. So if they have people that are actually that have reasons of practice that make sense in that context for that position, they'll be giving that candidate preference. So how do we convey supervision requirements in the CV and cover letter? So you don't specify your level of supervision, because that's going to be decided in the process, you know, with the hospital and APRA registration and so on. You just put in your CV that you require to work under supervision, and the level will be decided after you get a job. Cover letter is for visa application. So the cover letter is not, you can mention your visa requirement in the cover letter, but the cover letter, the purpose of that is to tell the hospital your background, your experience, what you can bring to that role, and actually show them not only that, but you know, not only you can bring, but what you understand from what they are advertising. Okay, so I always advise IMGs, before you write a cover letter to any application, go and do your homework in that hospital. Make sure that you understand their patient base, the type of presentations they see during the year, and so on, because there are many hospitals in Australia. presentations are very different from metro areas to rural areas and so on. So having an understanding of what their patient base is can add a lot of good information to your cover letter, because it shows them that you actually have done your homework, and you can match that with your experience and what you can bring to the role. So the cover letter is not specifically for visas, okay, but more about your experience and background and what you can bring to that role, adding together, you know, what you've learned about the hospital and the role and what's required, and bringing that just to one document. So the other question is, what are the chances after passing AMC Part 1 with 4 years of experience? So what are the chances of getting a job, I'm assuming? Look, as I said, every IMG is different. And we are talking here about different hospitals as well, okay? The only thing is, what I can say is the pool is massive. It's very, very, very big. As Aaron mentioned, it took him 5 years to get a job in Australia. He got 6 offers after passing AMC 2. I believe that everyone will have their own experience, and everyone is different. But pinpointing what are the chances is actually very, very, very hard, because I don't have information in your background. I don't have information in your training. So it's, there are chances, yes, there are chances, but you need to be totally aware of that you are part of a massive pool of candidates going through the standard pathway. Is there a difference for Australian citizens with AMC Part 1 and AMC Part 2? Well, if you are in the country, if you are onshore, your chances of securing something are higher, because one of the 2 massive roadblocks for hospitals are actually supervision and providing visas. So if somebody is onshore, they are not going to be looking only at the fact that they have, you know, a PR or they are a citizen. They're going to be looking at all the other factors that I mentioned here previously. But yes, being onshore, having the citizenship can increase your chances comparing to the candidates that are actually offshore. But again, is a number of things, is not one thing only. And I think I only have one more. What exactly should I do to build my future application in the right direction, being on a 4th-year medical student from Pakistan? So again, we can lean on all the things that I said in my presentation, but again, every case is different. So my advice here is, it's very difficult for me to give personal advice because I haven't seen your CV or anything like that. So the best thing to do is complete an inquiry form. I think Arnold released the link for the inquiry form. I can look at your CV and I can let you know in more details, something more based to your case of what that would look like for you, okay? And then the last question, what is the difference between being an Australian citizen for the process of AMC 1 and 2 with Bachelors of Medical Science and Master of Public Health? Again, Eli, your case is very different from many, many cases here. And to answer that question, I really need to look at your CV to give you a proper advice. So please just fill up an inquiry form and I will get back to everybody this week, you know, advising you what would be the best way forward for your situation, okay? Because there are so many, you know, there are so many different factors that interfere, right? We definitely need to look at your background, where you are, your training, your eligibility and so on, before I advise you anything very, very specific, okay? And Aaron, I think now you can follow through with your questions.
All right, so thanks, Francine. I have some questions that came up here. I'll do my best to go through all if I can. All right, so the first one here for Vivian. Could you please explain what exactly locum post is? You're a medical student. So locum It's a type of a position that you can hold when you have general registration. You need to be an independently practicing doctor. That means there's no level of supervisions here. You're just fully registered. You're independent practitioner. And locums, it's something that people do when you have general registration, because the clinic or the hospital pays you almost 3 times or 4 times more. You can earn quite a lot more, but the locum positions are not accredited into training programs. So there's a give and take. If you're planning to go into training programs, you need to have experience. You can use the locum positions, but sometimes they're not very favorable. It's just positions that the hospitals or the clinic deeply need your service in order to cover the shifts in that position. Okay, so the next one is, so some of it, I think, Francine, you might have covered it. I'll just quickly skim through it. Can we apply for APRA's limited registration before applying for our jobs? No, the answer is you need to get a job first before you get APRA. And the next one is, if I've worked in a surgical department in my home country as a resident medical officer, but want to start in Australia as a GP, can I do that via the standard pathway? And what is exactly the role of a registrar with limited registration? So these are really some deep questions, but if you're really just starting, the most important thing I find, this is my personal opinion and experience, everyone, like, what Francine said, and in my experience, everyone has a very different tailored pathway. The journey is so complex, it's like an ocean, and there's many ways to reach your destination. All you need to have is a strong set of belief and a strong mindset to keep going forward. The thing here that I want to tell you is, you need to find your first job. And what I know, in Australia, the first job usually comes from the department that is very desperate for doctors. Emergency department is really good because the turnover rate is really good. Psychiatry is one department that not many people like to go into. So if you can tolerate psychiatry, that might be something you consider. But at the end of the day, if you can do something, if your CV is good and you have the caliber, that means you have the experience and the ability to go through the interview and demonstrate your value to your employers, they will hire you. The next one is from Helen. As a non-citizen, non-PR holder. So Helen, I started like that. I came to Australia on a tourist visa. Taking observership in the hospital, is that possible? Because I have seen so many advertisements that does not take foreign IMGs at all. It is very, very depressing, to be honest. But look, I am a standing proof that you can come here on a tourist visa and still be very successful. All you got to do is do the right things. You pass your AMC Clinical, the first exam, come through the journey, apply for jobs, go for jobs that is suitable for you. And if you, I mean, just like what Francine said, we need to see your level of experience, your, how much of clinical experience you have. Do you have any gaps? If you're starting entirely new, like one of my clients earlier, Richa, she did not have any clinical experience. She had to pass the clinical exam to be provisionally registrable in order to be deemed the same level as internship in Australia. Okay, so it really depends on what you are. Everybody is a bit different. So you can be successful, Helen. You just have to follow through the steps. And get help. Sometimes it's very confusing. You need to get the right help. The next one, how realistic is aiming for MM2 and 3? MM2 stands for the Monash model. Yeah, Monash model. It's the classification of areas based on like how rural it is. Okay, the most rural is MM7. 2 and 3, it's somewhere in the middle. So it's not impossible, Omar, if you're asking. If with AMC 1 you're going to be limited registrable, limited registration. Okay, you can be. APRA can support you with limited registration, but yet again, it depends on the position you're applying for and how comfortable and how much you can demonstrate the value that you can provide to that department. It's all about that. They just, the people in the hospital, they just want to hire people who can do the shift, who can function as a syncytium. That means togetherness. You can work together. Your EQ is better. And by the way, since we are talking about this, there's a report by Deloitte. They did a study, and it shows that only 10% of success is contributed by IQ. And to be successful, 85% and above comes from your EQ, how you communicate, how you demonstrate, how your non-verbal communication is able to push people to say like, hey, we should hire this person. Those things are one of the biggest factors that will determine whether you get a job or not. Okay, so the answer is yes, you can. It depends on the position and depends on how you do your interview. The second question from Omar, AMC2 is a prerequisite for landing RMO job via standard pathway. Okay, is AMC2 a prerequisite? It's not really a prerequisite, but it's more favorable because you can be, for you to get level 2 supervision is higher when you have the clinical exam. And you know how I know that? I got my level 2 supervision from APRA itself. I wrote a newsletter on that. You can go to Dockroach and check one of my most recent newsletter. It's called Stop Being a Prey. I talked about them in there. I talked about the prey and predator relationship in the Australian health environment. How my supervisors was keeping me in the hospital. They don't want me to move out because they want valuable people inside. And I wanted to move out because I wanted to do something else. I wanted to go into a different system, but they were keeping me in the hospital with level 1 supervision. Level 2 supervision is more favorable. So the tertiary hospitals were not able to accept me. Somehow I did not give up. I managed to pursue my dreams, and APRA have approved my level 2 supervision through the hospital that I was planning to get into. So it is possible with the AMC clinical exam. Next one. What do you mean when you say experience aligned with Australian healthcare systems? What experience is needed? What is a bridging course? Okay, this is from Apurva. So basically, Apurva, if you're going for an interview, the people who are interviewing you is, they are some of them are from the medical workforce, and some of them are your supervisors in the department. Okay, they are the people who make your schedules and bring you into the team. What they are looking for is how well you can explain to them how you would manage a certain situation. Okay, they will give you a scenario and they will check two things. The first one they will check is basically, like how much you know about a subject. But the other thing is it's something called more on your conduct, your behavior. How you manage a colleague who is not doing the right thing, or when you have a certain complaint, or when something happened, they'll give you a scenario. This thing happened, a wrong medication was given to a patient. They want to see what's your insight. Can you function? Can you do the right things? Do you know how to make an incident report? Those kind of things. Can you give open disclosure to patients? If there's something that went wrong, how would you do that? They will ask you this question. So what they are looking for is whether you have the capability, the credentials, the ability to do how an Australian doctor or local graduate would do. Okay, that's what they're looking for. They will ask you these questions and they'll try to gauge whether you can be hired here. Because when you get hired, they don't have so much of time to teach you everything. They're looking for people who already know most of the things. So that's why you need to bring yourself up to standard. So what is a bridging course? Bridging course is the most common type of courses here. It's like for me, I look at it like the old school way of preparing for the AMC clinical exam. It's all about, telling you what the exam is all about, giving you the questions. And the questions, if you've been to some of the bridging course, you might see some of the questions are very, very, very poor. It's like 1 or 2 lines, doesn't have much content in it. And I didn't like it. I almost failed my exam. I thank God I checked in with those people who have passed. I keep checking with them what are the top things that you need to do, and I somehow came out very far. You need to have the right question. You need to have the right sort of mindset and practice system in order to work for your clinical exam. But bridging course is the most commonly registered type of course that provides the teaching for the AMC clinical exam. The next question, what is the preferred gap between the AMC 1 and the AMC clinical exam? I get asked this quite a lot. Thanks, Smriti, for asking this question. So here, the AMC clinical exam is very different from the first exam. The first exam is a multiple choice question, but the second exam is really a patient-centered exam. It's all about conduct. It's all about behavior. It's not about IQ. It's about EQ. all right? It's about imagination, it's about instincts. So the gap to build this quality depends on where you are starting. Some people need between 3 to 6 months. That's what I usually tell my coaching clients. If you're starting to prepare for the clinical exam, you need about 3 to 6 months, regardless how far your AMC 1 exam is. You might have passed your AMC exam 2 years ago, it's fine. But as long as you put 3 to 6 years into your clinical exam practice, and you practice really, really hard, you do the right things, you do a lot of questions, you get the right feedback, you will pass the AMC clinical exam. And the gap is not so important because, you know, you can have a long gap or you can have a very short gap, but if you don't do the right thing, it's still the same. You know, the outcome may not be very successful. So to summarize, put aside 3 to 6 dedicated months. Don't do more than 6 months, because if you're more than 6 months, you become complacent. Your practice will start going down. I've seen people, they improve. After 6 months, they come down. And then by the time they do the exam, they lost their time management. They lost the reflex. How fast to answer? The next one.
Last question.
The last question here. So I'm just going to the last question by Helen. An IMG who have trained in a non-comparable country, that's most of us here, Helen. Most of us in the standard pathway is deemed in that way. There's only 5 countries in this world that is coming through the competent pathway. So everything else is so far standard pathway. Okay, with no citizenship or PR, how do we build local Australian experience without having a gap? And hospital observerships often don't take non-citizens. Does taking observership at a GP clinic setting help? Yeah, so the answer, the last one there, it's an easy answer. So if you can do observership anywhere, it's going to help you. The idea is just to see how a doctor interacts with the patient. Okay, and you need to have something called a patient-centered communication. All right, and that is very different from a paternalistic type of communication, where most of us, you know, from a not a Western country, you know, from outside the Western country education, we are usually trained in a paternalistic type of communication. If you can get observership, it'll be great. It is not very easy. I did not went through any observership at all. All right. What I did was I went for my interviews. I speak to, you know, the supervisors there. Each time I failed my interviews, I failed it 5 times. I always call them back and I speak to them at least 30 minutes to get feedback. You know, I try my best to get as much feedback, and then I practice that in my own role plays. That's how I improve. But if you can speak to a local person in Australia, if you can migrate to Australia, or if you can move to Australia, you can just mingle up with some people here, join some community event, you know, just speak to people in Australia, having the Australian accent, having the Australian culture, it helps a little bit. It's not easy to get into observership. Some programs you need to pay for it, but it's not always important. If you can join some courses that has those programs, it's not very easy. You know why it's not very easy? I can tell you why. Because the health regulators in Australia, especially the Medical Board of Australia, and the safeguardians, I call them, of the community. These are people like the health commissioners of complaint or the health ombudsman of Queensland. These people, whenever there's an issue with patient, whenever there's an incident with patient, they will see who is in that area. If there's someone who's not registered, who's not supposed to be there, and that incident happened, that hospital is going to be in a big problem. And therefore, they need to do a lot of things in order to get people who are not registered to be in the system, because the medical legal in this environment is very complex. And that's why it's not easy to get observership. I'm not too sure whether that's going to change or not. Like right now, I'm looking at the environment and there's not many programs, but all I want you to do is try to find ways to be able to speak to Australian people. If you have the ability to do other programs, let's say if you come here, you know, and you can get into other types of jobs. Some people, they go into a different type of jobs. They somehow manage to get into a different type. Like I had one person who somehow, you know, managed to get some work rights. It's not very easy. It's very complex. You know, if you're very young, you're less than 30 years old, if you can do like the work and holiday visa, you know, you can go and work in some of the local communities and help help in some of the healthcare programs there. You know, like with simple things like a helper or someone who does things that you can see how the doctors and nurses communicate with patients. That is enough. You can already learn from it. right? You just need to work really hard to find those places and those opportunity.
Okay, that's it.
All right, so I'm out of time. So thank you. Hopefully that helps.
Oh,
Francine,
sorry, I
you're
don't think
mute.
people can hear me. I do apologize. So thank you everybody for spending the time here. I know it has been, a few hours, but I'm sure this information has been extremely valuable to you guys. I'm just adding here our websites. So if there is any next steps, any further advice that anyone requires, either from me or from Aaron, here we have some information for you. Some of it as well was thrown into the chat for you guys. I can see here that I received some forms already, which I'll be replying to this week. The recording will be sent to everyone tomorrow. So thank you so much for being here today. We are very grateful that you stayed and you were very committed and you are very participative. We appreciate your time and we are available. Send us an email with your questions or anything you'd like to know further and we'll be happy to help. Thank you so much. Thank you, Aaron. Thank you, Arnold, for your help today. And I hope everybody has got a lovely afternoon.